If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. This is our 17th season, and as you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to be an informed patient, and we're here to bring you timely health updates. Now, for those who are new to the show, there are two ways to get your questions in. First, calling the live phone line at 718-499-6101. And second, you can email the questions to AskTheDoctor at netny.net/AskTheDoctor, and we'll bring them into discussion. For this episode, we have Dr. Anna Saponia, internal medicine. She's an attending at the New York Methodist Hospital, and Dr. James Scanzo, who's chief of dental and oral surgery and implantology at New York Methodist Hospital. Welcome. We've got a great panel today. And
great to be here.
Hi, Kirsten. How you doing?
Hi, Dr. Garner.
Good to see you.
Thank you. Very glad to be here.
You haven't seen these two in action before, but you got here two superstars. The last time we had Dr. Scanzo, he took the whole show up. He had his entire family calling. No, I don't know who it was. I'm not saying who it was, but 20 calls. I mean, it was amazing. And Dr. Saponia, who's always commenting on the set a little bit. What do you think? You have some questions about the design.
Right. So you mean the design, the background?
Yeah, we'll get back to that. We'll come back to that in a little while. But it's great to have everybody here. We have a great show. Kirsten, how are things? Is settling down a little bit?
I am. I've been painting my apartment, just busy settling in and trying to stay warm.
Yeah, it got cold all of a sudden. Well, before I get to In the News, let me remind you to call. The number is 718-499-6101. Or don't forget to email at AskTheDoctor, netny.net/AskTheDoctor. Now, in the news. Well, we had a very interesting news this week,
Yes.
The bald truth about heart attacks. It turns out that if you look at a patient and he's balding, if he's got little patches around his eyes, or he's got a crease in his earlobe, he's at a higher risk to develop a heart attack. I don't know who sat there and decided to do that study. You got to wonder about the mentality of the guy who wanted to do that, but it's kind of interesting. And they found that there was a 50% increase of getting a heart attack. So if you want to look in the mirror, look for those little creases on the ear. I happen to have them. And
you have to be balding, though?
You have to be balding. And the other one is around your eye, these little plaques, little fatty plaques. Okay, that's in the news number one. Okay, let me see if I can impress you better with the second story. Second story is winter heart attacks. Surprising news. Everybody thought you go down, Florida, you're going to be protected from heart attacks because it's warm weather. Turns out it's not the warm weather because they get the same number of heart attacks in the winter there and the summer that we get here. So it seems that it's probably, could be people getting depressed in the wintertime. It's not as much light, they don't get out as much, and that could be a reason. But the basic news is you can't escape it by going to Florida. Now the salty six. The salty six are those foods that give us the most salt. Not that they're the saltiest, but when you add them up, they give us the most salt. Those foods are bread, cold cuts, pizza, chicken, soup, and sandwiches. So, I mean, I see a lot of lamentation, if I call it, right? I mean, you like those foods. But that's where the area is to cut down on. And finally, I'll try and impress you with this one, okay? We had three that weren't the best. This one is a good. Alzheimer's disease can be detected more than 20 years before the first symptoms, which is important because then you can treat the disease. So it's something to think about because we do have pills. If you give it early enough, you can forestall these symptoms. So this test is in the blood, is in the spinal fluid. We need to find a way to get it, relatively easy. So you can't stick everyone in spinal fluid, for that. Kirsten, how about the quiz?
Okay, absolutely. And really quickly, I need to correct you from earlier, Dr. Garner, because you were saying the email address had a /AskTheDoctors in the end. In fact, the email is asktthedoctor@netny.net.
Okay.
So that's the email address. We want you to email us with your answers to these quiz questions. Are you ready? All right. Yesterday was Veterans Day. To honor all of our veterans, this week's trivia quiz helps to recognize the occasion. So the 1960s marked the invasion of the British rock groups. That was a really cool time in history. The Beatles had the #1 and the #3 best-selling records of the 1960s. It was I Wanna Hold Your Hand was #1 and Hey Jude was #3. The second biggest selling record was written by an American soldier recovering from wounds from the Vietnam War. Now the quiz question is, can you name this song? Now the second quiz question, the Diocese of Brooklyn has 4 churches that are on the list of the U.S. National Register of Historic Places. Can you name one of them? Just one. If you can, give us a call or an email.
So we're going to take a short break, and when we come back, we're going to be taking your calls. Now the number is 718-499-6101. The topics are internal medicine, dental and oral surgery. Don't go far. We'll be right back. And welcome back to Ask the Doctor. Before we get to your questions, of course, I want to acknowledge Monsignor Bennett. Give him a shout out. How you doing, Monsignor? Good to see you. Always sits in that same chair every time. Amazing. And here's any shout outs to our loyal viewers?
We have a lot of shout outs today, Dr. Garner. First, shout out goes out to my friend Eric Murphy. Hi, Eric. Also, Super Joe.
He's a super. He happens to be a super.
I think he's extremely super for watching, especially. More shout outs to Antonio Morales, Reverend Dr. Doritha Custis, Josefina and Anthony Oricchio, Kevin Breen, chairperson of the Francisco Locasano Foundation, Lucy Bruno, vice chair of the Locasano Foundation. Thank you all so much for watching. We appreciate it every week.
Thank you very much. Thank you, Kirsten. And I also want to give a shout out to Dr. Chabelle, who's going to be honored this week for his work that he's done on behalf of New York Methodist Hospital and the Brooklyn in general. And also the Francisco Locasano Memorial Foundation, who presented Hope Fest a couple of weeks ago, honored Bishop Casciano, my brother Dr. Garner, Janet Malpiso, and Jalissa Carson. That was at Julio's, which unfortunately had a devastating result from the hurricane. Anyway, tonight's topics are internal medicine, dental and oral surgery. The number to call is 718-499-6101. Or you could email the questions to askthedoctor@netny.net. Let's go right to meeting the doctors, and then we'll get to the phones. Dr. Scanzo.
Thank you for having me.
Can you tell us a little bit about your travails of the last couple of weeks?
Well, I'm from Rockaway, Bell Harbor, and we had the ocean come right up our blocks, down our basements, in our first floors, and place is basically a war zone, but we're recouping pretty well. The sanitation, Army, Marines, they've all been in this week full force, and they're doing an unbelievable job cleaning us up. So thank you to all of them.
And you had water in the basement of how many feet?
7 feet in our basement.
Just incredible, incredible. And you're a swimmer, an avid swimmer?
I'm a swimmer, but I got out when I saw that ocean coming.
You got to respect that ocean.
Absolutely.
Thanks. We'll be looking forward to your
Thanks for having me,
calls.
Steve.
Dr. Saponia, how are you?
Very good.
Do you have any trouble with the hurricane?
No, we live in Battery Park, which is very flooded area, but our house luckily was not affected by this. Just 2 feet from our building entrance, water stopped.
Wow.
But the rest of the buildings next to us, even now, they don't have electricity.
Amazing. That Battery Park was out of electricity for now 3 weeks.
Right.
Amazing. Well, Kirsten, you didn't get hit by the hurricane, did you?
We were very lucky. We had power, no flooding. I live in Astoria, so it's a little bit higher ground up there, farther away from the water. So extremely lucky.
So do we have any calls yet?
Oh, we do.
Oh.
So line 1, we have, I can't even read my handwriting. He's from Bed-Stuy, Brooklyn. I think it's Jeremiah.
Jeremiah. Remember the song Jeremiah Was a Bullfrog?
Oh, it's Jeanette.
Jeanette is a different song. Okay.
Totally.
On number 1?
Number 1,
Okay.
sorry.
Hi, Jeanette.
Hi.
How you sound a little nervous?
No, I'm not nervous.
Very good. Where are you calling from?
I'm calling from Bed-Stuy in Brooklyn.
Very good, very good. And what can we do for you tonight? You have an answer to the quiz?
No.
Do you have a medical question?
Yes.
Take a guess. Okay.
5 years ago, I had a fungus ball on the left lung. And
What was on the left lung?
A fungus ball.
Fungus ball, okay.
On the left lung. And they removed it. And they had to intentionally break one of the ribs to get to the lung. Mm-hmm. Now I have like cramps in that rib. Do you know why?
I mean, it's Dr. Saponia.
Okay.
I think it's always when you do the surgery, there is a distortion of the anatomy and the cuts to the nerves, to the blood vessels, mostly for the nerves. They're in the areas where the lungs, it's a lot of costophrenic nerves, and if they've been cut, it's the same syndrome as like phantom syndrome, you know, that when people would be having like amputation of the limbs, they still have pain in that areas, like in the leg, when the leg is not there. So sometimes you might have that area in a, in a surgical place because the nerves were cut. And it causes like musculoskeletal pain. And of course it's nothing to do with your original disease, but I know it's painful. So you need to manage it as a pain.
So it's no pain. There's no pain. It's just like a cramp that comes there.
Mm-hmm. When the nerves cut, the all pain, it's not exactly pain as you would have in other areas. It's like tingling, numbness, sharp pain, electric kind of pain, cramping. It's all names for neurological type of the pain. So I'm sure this is what it was. It was neuralgia.
Jeanette, I hope that helps, so it's not too serious, right? Should be getting better.
I think with pain medications, it's going to get better.
Be well, Jeanette. Have a good night.
Okay, thank you.
Who do we have next?
Okay, so we have Paul on line 2, and he's from Regal Park.
Oh, out there in Queens. Hi, Paul.
Yes.
How are you tonight?
Good, fine, thank you.
Could you talk up a little bit?
Yes, hello?
Yes, we can hear you. What can we do for you tonight?
Yeah, I'd like to answer the trivia question.
Okay, wait a second. I get Kirsten and the group to ready. He's answering the trivia question. Which one?
About the song.
Oh, let's see. What do you think it is?
I think it's the Ballad of the Green Berets.
Well, I got to check with our authorities here. What do you think, authorities? Oh, very good. Wow. How'd you get that so quickly?
Well, I'm a Vietnam veteran. I remember that song.
Can you sing the first 2 bars?
No, I can't.
Remember that fighting soldiers from the sky?
That's right. That's the one.
What's the next line?
No, I really don't. I can't remember it really. I remember
all right,
the name.
all right.
That's okay, you got it. So congratulations, Paul. Just remember to send us all of your information so we can send you your plaque, and send it to askthedoctor@netny.net. Good job, Paul.
I'm shocked that you got it so quickly.
Wow. Yeah, it was great.
I'm also shocked that was the second biggest selling song of the decade.
Yeah, it was a big song because that was an era when Vietnam was going on.
It wasn't a popular war, yet this song was popular.
The song was popular, and he was a Green Beret, so...
You know whatever happened to him?
I never heard from him again. No.
Yeah, you don't hear much. He's not with us anymore, but...
Oh, he passed away.
Read about that in one of the books, interesting story.
I will, thank you.
Okay. I was thinking how the songs have changed, like I Want to Hold Your Hand was looked upon as, by the older people as not proper. And now look at today's song. If I want to hold, whatever. I don't know. Forget it. I don't know. It's not a good one. So, all right.
Times have changed.
Who's next? We better move on to
Okay,
that.
so on line 3, we have Lucy from Richmond Hill, Queens.
Hi, Lucy.
Hi. I'd like to find out, should I have gum surgery every 2 years? I have issues with my gums, and the doctor said I should have gum surgery every 2 years in order to maintain my teeth.
Let's see what Dr. Sconzo says.
Lucy, you don't need gum surgery every 2 years unless you're having an active problem with it or even a chronic problem with it. You should be having your teeth cleaned probably every 3 months, but you only have surgery if you have a severe periodontal problem. Other than that, you don't need to have surgery.
Okay, thank you.
What does the procedure do exactly?
Well, there's a lot of different surgical procedures, but one of them is to lower the gum to make the pocket a little bit shorter so it doesn't catch as much food, and you can keep the teeth cleaner that way.
Very good. So What's the most common thing people come to the dentist for these days?
These days, still gum disease. It's one of the most prevalent diseases that are around. And missing teeth, decay, depending on where you're at.
Do you think there's been a big change in the last, let's say, 20 years in that?
Drop in the decay rate,
Yeah.
especially with the fluoride supplements, fluoride in the water, definitely drop the decay rate.
Okay. Thank you very much for that. You know, I'm getting some interesting emails. Kirsten, any emails?
Yes, indeed. We have an email actually from Syria. Can you believe it?
I can't believe it.
That's amazing. Thank you for watching, first of all. The email is, I'm having a problem, and none of the doctors in the Middle East can do anything about it because they're not very familiar with the sickness. It's about his niece. She had a normal birth. It was in good condition, but when she was 4 years old, she was hardly walking and talking, and it was hard to control her emotions. They showed her to the doctors in Lebanon, Jordan, but no one knew what to do. They think there's hope in Germany, and they think they're going to be able to get there. But they watch your show, they watch our show, and they're wondering if you guys could maybe assist in the situation. And that is best regards, Mohammed.
And we do have, just to show you, we have these some lab results and so on. They also emailed. And this person, Nora Al-Hassan, is 6 years old, has maybe Rett disease, Rett syndrome. And this is a degenerative process of the nervous system where it goes downhill after the child develops normally up until age 4. Unfortunately, there's not a lot of things other than supporting the child and filling in when there's a lack. For example, when the electrolytes are out of whack, fixing that. There is some improvement in the teenage years. So it's a lot of this out of our hands. It's really in God's hands and how the child does. But the prognosis is a tough one because this is a very severe disease. So he's looking, you know, for any kind of help. Basically, his doctors should be able to handle the problems that this child will undergo, if this in fact is the diagnosis, which is what they're working on. So it's a tough one. But thanks for the email.
Thank you so much. And you ready for another call?
I don't know. Let's see.
I think you are.
Okay.
Okay, on line 4, we have Patricia, and she's from Brooklyn.
Hi, Pat.
Hi, how are you?
Did they call you Pat or Patricia?
Pat.
You're very good. Where are you calling from? Which part of Brooklyn?
I'm calling from Sheepshead Bay.
Beautiful out there. They got hit pretty hard?
Bad enough. But my daughter was out on 116th Street in Rockaway, and she stayed, and, you know, it was really bad. She went into shock from everything. It wasn't good.
Dr. Sconzo was telling me some people stayed. What were you telling me, Jimmy, about that?
Yeah, the people that stayed, I mean,
she shouldn't have stayed. She shouldn't have stayed. And then I have a daughter in Staten Island, you know, but she was without lights and heat and all, you know, with 2 children, you know, my grandchildren. So, you know.
What can we do for you, Pat?
Well, I think I know, well, I hope I'll know the question about the churches.
Okay. We're
Should
ready
I
to go.
say?
Right,
Okay, I'm going to take a chance. I'm going to say St. James Cathedral.
Is it St. James Cathedral?
Yes.
Oh, Pat.
No. Okay, well.
I like to laugh. It's good. To lose with a laugh is good, right?
Indeed. Better than a cry.
I'm glad we were able to give her some good and happy moments tonight. All right, Pat, call back soon.
Okay, thank you very much.
Okay,
Have a good night, everyone.
Thank you.
Bye.
All right, so we have Mike on line 1. He's from Queens.
Hey, Mike. How you doing, Mike?
I'm good. How are you?
Good, thanks. What part of Queens?
I'm in Long Island City.
Long Island. Did you get hit hard out there?
No, not at all.
Okay. That's what you see when you're driving on the FDR Drive and you look across. That's Long Island City?
We were pretty close to Astoria, just off the 59th Street Bridge.
Very nice. Kirsten likes it out there.
Yes, a lot.
It's very nice indeed.
What can we do for you tonight?
Well, I have an answer to the second trivia question.
Oh, beautiful. What do you think it is?
I think it's the Church of the Holy Innocents.
Is it? I missed the end of it. Did you hear the
Church of the Holy Innocents?
The Church of the Holy Innocents. Is that the answer? Whoa! I mean, you can't even pick up the phone without. I mean, it's pandemonium here. I don't know how'd you get that.
That's great.
How'd you get that one?
I have some friends that go to that church.
Oh, so you asked a friend?
I did.
Yeah, it's okay. It's okay.
It was like, who wants to be a millionaire?
Excellent. So what are you going to do with the plaque?
I'm going to hang it proudly on my wall.
See, proudly.
Yes.
I love that.
People love. There's about only 30 of these in existence.
I will hang it proudly and think about this day forever.
Well, I'm feeling a little romanticism here. But,
Indeed. Well, Mike, in order to receive your plaque that you are so excited about, don't forget to email us all of your information at askthedoctor@netny.net. Okay?
I will do that. I will do that.
Perfect.
I need a break. I don't know about you guys, but after that, I mean, we got to take a short break here. We get recharged. I'm zonked from all this, so we'll take a short break. And the number to call when we come back is 718-499-6101, or you can go to the computer, if you know how to use that, to askthedoctor@netny.net. And we're going to have a lot more calls coming in and so on. We're just going to take a short break, and don't go too far, okay? Welcome back to Ask the Doctor, where our topics are internal medicine, dental, and oral surgery. We have Dr. Anna Saponia and Dr. James Sconzo. Call us at 718-499-6101 or email us at askthedoctor@netny.net. Dr. Saponia, tell us a little bit about flu, what's new this season, who should get the shot, who shouldn't?
The same category people as always, mostly people who has 50 years old or older without any diseases, and the rest of the people, if you have any chronic diseases, no matter what the age, you need to get the shot. And now the shot include all the swine flu, all the H1N1
Did you get the shot?
types. Yes, I did.
Okay. You got it, Jimmy?
I got it.
You got it, Kirsten? Well, next week on air, we're going to bring it in and give you the shot.
Oh, no.
Okay, so something to tune in for. Okay.
Please, no.
Okay, we're going to have a whole skit where she's going to say, please no, and I'm going to come at her. And we'll say, it's a whole story. Wait till you see this. So I hear already the guys are setting the VCRs.
Yeah, right.
So let's see. I see we got a busy group here.
We do. Lots of people are calling in. So on line 2, we have our old friend Patrick from Park Slope.
Hey, Patrick. How you doing tonight?
How you doing, Dr. Garner?
Very good. How's your teeth?
My teeth are not good. That's why I'm actually calling.
Well, I got the right person.
I got 2 teeth that need to be pulled. There's not much left of them, Doc.
I'm glad you finished that. You got 2 teeth, I thought you were going to say.
No. They're in the back, one on each side. And I don't want to get them pulled, but there's not much left of them. Is there any way maybe we could get them redone?
There's always a possibility, Patrick, but you need to come in, you need to see the dentist, go to Methodist, and we can take a look at it, or your dentist can, and it just depends what's left of these 2 teeth that you have back there.
It's not a lot, but I really hate to lose them.
Are they your wisdom teeth?
What'd you say?
Are they wisdom teeth?
No, they're right in front of the wisdom teeth.
Okay.
Where did that name come from? Wisdom. Why did people thought they were wisdom? You don't know?
I'm not sure.
I had Dr. Saladino, but he's not around anymore.
Right, yeah.
Is he up in the Methodist?
He was at Methodist, but he's not there anymore. No, he's retired.
Oh, he's retired?
Yes.
Oh, so who can I ask for? Because I want to come in there and get these, maybe we could do something with these teeth. I hate to lose them.
Just come into Methodist. We're there all the time, and we'll take a look at it for you, Patrick.
Okay, Doc. You're the best. I got Big Vinny over here. He won a big weightlifting contest, so we're eating pizza and watching you guys tonight.
Who's that, Big Vinny?
Big Vinny, yeah.
Hey, Big Vinny. I can't hear him, but...
Yeah, he's over here. He won a big weightlifting contest. He's really got some shape.
How much did he lift?
You met him over in the hospital there. He had a little heart problem, and you went in there and you thought he was Mr. America.
Yeah.
You remember?
I do.
All right. Doc, listen, God bless you, and I'll see you guys next week.
See you next big show next week. Big finale.
Yeah, I'm going to come in and give Kirsten that flu shot.
Okay.
Great.
All
right, Patrick, calm down.
Take care, Doc. Okay,
You're
have
lose
a good
those
night.
teeth.
Yeah.
Okay, take care. He's got 2 teeth. Kirsten looks like she's going to take care of those 2.
Yeah, now I am.
So tell us what's this Invisalign?
Invisalign's a very thin tray. It's actually, you don't need to put braces on your teeth anymore. It's a clear plastic tray that you change every 2 weeks, and it incrementally moves your teeth slowly, just a little bit at a time. And you usually get 2 sets of trays. Wear 1 set for 2 weeks, switch it out, put the other set in, and then you go back to your dentist and he'll take a look, see what the progress is, and he'll switch out for the next 2 sets of trays. And over a period of time, over a period of months, it magically just moves your teeth. It's fantastic.
You go to Dr. Scanzo's office, it's amazing. I got to say, the most friendly staff I ever met.
Thank you,
Steve. Florence and Allegro and Barbara. I mean, just, you got to see this. He's in Marine Park, so if anybody wants a dentist, not just because he's on the show or anything, this is the best.
Thank you.
So,
Thank you.
What do we have, Kirsten? Did we lose line 3?
No. Jay is on line 3. He's from Manhattan.
Hey, Jay, how you doing?
I'm fine, thanks. How are you?
I'm good, thanks. What part of Manhattan?
Midtown Manhattan, by Columbus Circle.
Oh, good. My daughter lives on 59th, not far.
Oh, wow.
They've got a beautiful building there. You know, do you see that Time Warner building?
Yeah, of course.
Nice to walk through and stuff?
Yeah, that's where Whole Foods is.
Whole Foods, yeah. Well, so you sound a little down tonight.
Huh?
Jay, you sound a little down. I don't know. You don't sound...
Yeah, I am a little bit.
What's up?
Well, the thing is, I just got dentures. And, you know, I got them, you know, I got them the other day. And when I went for them, they told me I had enough bone to do the whole job. I'm watching this as I'm talking to you, so.
What are you watching?
You.
Oh.
You know, it's coming in afterwards, so.
Oh, it's a good idea to turn down the set. They got this new thing out, the 7-second delay.
Oh, okay, let me turn it down.
You got it? Okay.
Anyway, so they told me I had enough bone to, you know, to do this, that it would work, and there wouldn't be any problem. Because, you know, now they do implants on the bottom and so on and so forth. Anyway, I just got the dentures. The top doesn't hold. And, you know, somebody told me that the, you know, the suction of the palate is supposed to keep it in.
Yeah.
But they told me that my ridge, you know, the ridge on the top is very small, and that's the reason why it comes out. And I'm just wondering what to believe.
Jay, is this something that you pay for it and it's not guaranteed?
Well, I got it done at, what do you call it, NYU.
Let me ask Dr. Scanzo, can you tell what the procedure is that he's talking about, and then, you know, what should he be doing?
Jay, it sounds like it's your upper denture that you're having trouble with. You just had the denture made. Is this your first denture, or have you had dentures before?
First one.
First one. And did they just take the teeth out and put the denture in the same time?
No.
So you were without teeth for a while?
Yes.
Okay, so yeah, your ridge will shrink over time. You can look into implants, and sometimes there's even what's called mini implants. If your ridge isn't wide enough, sometimes you can get away with these mini implants to help hold your denture in. But NYU does a lot of implants there. It's a great place to start, you know, to see if they can do anything with implants to help retain that denture.
So the palate doesn't keep it in?
Ideally, the top you can get a suction, you know, to help hold it in. Not all the time. The bottom you'll never get a suction. Top, sometimes if you're lucky enough, you can get a good suction to help hold that denture in. Have you tried any of the pastes or the powders?
That's what I didn't want to do. I told them that in the beginning. They said I wouldn't have to do that because I had enough bone.
Right. Well, that's where I would start right now. You never know with dentures when you make a set of dentures. Yeah, you would love them to suck right in there, but it doesn't always happen. So I would try the paste or the powder first. Then you can go back to NYU and look into the implants, if that's a possibility.
Okay.
Dr. Scanzo, is that something, though, I'm not joking about if you pay for it and it doesn't work, is that something that you're out of luck?
You know, they could go back, they could try to reline it to try to help them out with it, but there's no guarantee with anything like that.
You just hope that they do a proper pre-planning.
Exactly.
Sorry, Jay, to hear about that. Fill us in. Let us know what happened.
Okay, thank you very much.
Take care. What do we have on waiting patiently on line 4?
Well, it's our friend Dolores from
Oh.
Jackson Heights, Queens, on line 4.
Hi, Dolores.
Yes.
How are you today?
Hi, Dr. Gardner. How are you?
Very nice. I like your voice a lot. It's got an ethnic.
You said that last time I spoke to you.
See, isn't it nice?
Yes, very. I just have a question to ask you. I don't want to hold you up.
Okay.
I went to dermatologist last summer, about a year ago, and I had it looked like blisters, like a pimple, and it came to head, was all over my shoulder and my back. And when I went to them, they gave me an ointment. They said, I think she said something about a fungus, something like that. I don't really recall. But then, a week later, underneath where my shoulder is, below it, I had like a pimple, but it broke out like a big, big blister. So I went back to her. They took blood tests, nothing showed, but then I went back. She did like a culture or something, and then a biopsy on it. And I waited for a couple of days, and then she says that I had MRSA. I don't know. When I heard that, I was like,
and
my God.
MRSA is this resistant bacteria that causes a lot of problems in athletes and young college students, military recruits, people living in close quarters usually.
Yeah, well, that's what she had told me, and she put me on a very heavy antibiotic.
Okay, so I'm going to tell you, the good news is it can be treated. There are plenty of antibiotics. And more good news, I'm going to have Dr. Saponia talk about it.
What I'm trying to explain, during this summer now, I had gotten it on the other arm, on my shoulder, but it was just like pimples coming up with whiteheads. I went there, and they put me on a heavy antibiotic. Is that what it causes? Why would I get pneumonia on my arm and my shoulder?
All right, so Dolores, let's hear what Dr. Saponia says.
Most likely the bacteria exists on your skin. And if you have any breaks in the skin, even microscopic, the infection may go in and cause a problem. So this is probably will happen with you. And it's very common if you have one particular type of infection, and like a few months after that you can have the same problem and infection, most likely the same origin. And the treatment is very heavy-duty antibiotics, because normal antibiotics, they're not the bacteria is not respond to normal bacteria. So that's why I think your doctor did a very good thing by doing culture, and in culture finding out what exactly bacteria is that, and not only finding bacteria, but to match antibiotics that would work with this bacteria will kill it. And that's why they gave you probably what was maybe less expensive, more common antibiotics, but it's exactly antibiotics you would need.
Yeah, but what I want to say, was that from MRSA too again, from the other arm?
I think most likely you have the same exactly infection, and to know for sure you might need to do a culture, but at the same time it's most commonly that you would have the same kind of infection that grows on your skin and doesn't cause any problems like in between the breaks, but when there is microscopical skin break, then infection goes in and causes a problem.
Oh, okay, but it doesn't, in other words, it's never, if I keep getting it, it's not MRSA, is it? I mean, I'm so nervous.
It might be MRSA, but I would say that if you would just use regular medications, regular antibiotics like penicillin group, it might not work.
They gave me an ointment for it too, a cream, and they gave me, what do you call for, like when you get an itch for allergy, they told me to take that too. In other words, it would stop the itching if I have an itch. I don't know why they gave me that.
What exactly did they give you?
They give me Benadryl to stop
the itch,
yeah.
Oh, okay. Yeah, this is all common. It's medications that would help in any type of infection. It's just for the symptom relief.
Like Dr. Saponia said, it's probably on your skin. You're carrying the MRSA, so it's in you. So you're going to get infections from.
I just want your opinion. I feel good when I talk to you.
Oh, I'm glad. And don't worry, but it's good. Our kids who are, let's say, who are in high school, shouldn't be sharing towels or drinking water.
I know. I've seen that on TV from the schools and all. Yes, I've seen that. But you know, when I mention Mercer, everybody goes, "What? Oh, you know, they had me. I'm ready. I was dead already."
Dolores, good.
When I heard-
Thanks for
Yes,
calling.
Doctor. All right, Dr. Gardner, it was great talking to you again.
Be well. And let's take a few emails, but before we do, let me talk about the phone line. So it's a very interesting phone number. It's 718-499-6101. That's 718-499-6101. Or email us, which we're going to do now, read some of them at askthedoctor@netny.net. It's a good time to call in. So, Kirsten, we have any, Kirsten?
It is. Right now is a great time to call in, and we are getting a lot of emails. So we have an email right now. It's from Sally in Queens Village. Sally says, I am a new listener to your TV show, and I enjoy every minute of it. Thanks, Sally. However, I do have a question. I'm 58 years old, and for the past 20 years, I'm suffering from hypertension and a cholesterol problem. No matter what I do, it's never normal. I'm using the same medication for the past 20 years. Do you think my system got too adjusted to the medicine and I need a change? My doctor does not want to change it.
Dr. Sapone, you heard the question?
Yeah. So I would say that hypertension is a disease which progresses with age, whether you treat it properly or not. So it's known, sometimes people starting on even 2 medications at once at the beginning of the hypertension. And then when the disease progresses, the medication changes, the doses changes, and some of the patients, they would be at the end of their life, you know, on 5 medications, 6 medications for hypertension. So I really feel like you need to see the doctor and change medications. It may be not that you getting used to medication. It means the progression of disease requires different treatment.
Interesting. Story about cholesterol today, actually. I don't know if you saw that. You don't need to be fasting. They feel that you get the same results by coming in and taking the test as opposed to fasting for 8 hours before, which is nice because a lot of people may not go in to get the cholesterol for that reason. Thank you for that, Dr. Sapone. You know what I'm always interested in? That children follow in their parents' footsteps. And I know Dr. Scanzo's father was in the same line, same profession, and maybe many of the people out there know him. Was that why you went into, you think, dentistry?
Well, it gave me a little background in it, but actually I graduated with marine biology from college.
Was that, wow.
That's what I was going to do. And then,
you ever see that Seinfeld where they're looking for a marine biologist? That was a funny one. Yeah.
He's got a couple of good ones with teeth too. So.
Yeah. But that's interesting, and your father's blessed memory now. But
Yes.
I'm sure he'd be thrilled to know.
He was when he was alive. So.
I bet you people out there went to him.
I'm
what was
sure
his same
many
name,
people
right?
did. James Scanzo. Yes.
Very nice. Dr. Sapone, how about your family? Were you influenced in going into medicine from your family?
No, I don't have any medical personnel in my family. But I was sick when I was 11 years old, being in the hospital, and was greatly admired my doctor, who was very caring. And
that's what started off?
That's exactly what started.
Interesting, interesting. Let's take a short break, okay? We'll come back. We got emails. We got a lot of phone calls now. We're talking about dental surgery, dentistry. We're talking about internal medicine. Anything you want to talk about. 718-499-6101. Email us at askthedoctor@netny.net. We'll be right back. And welcome back to Ask the Doctor, where our topics are internal medicine, dental, and oral surgery. Now let's get to some more questions. Kirsten, we have anybody in particular here?
We do. One of our most loyal viewers
no,
is
let
on.
me guess.
Can you guess?
Is it Grace?
Oh, it's not Grace, actually. No.
Is it Rosemary?
No, one more guess.
Joe Stiles.
You got to click to find out. Line 4.
How did he get through? I don't know. Hey, Joe, how you doing?
Yeah, well, okay, Doc.
Joe, it's good to hear from you.
Yeah, always a pleasure, Doc. You make a great image on this program.
Thank you.
And I'd like to speak to James Scanzo. I lost 6 teeth this year. I'd like to know what would he suggest the best. Can I do anything instead of implants?
Joe, do you know Mr. Joe Stiles? He's in his 90s. He's in great health. And he's talking about losing 6 teeth. 6 teeth.
Joe, do you have diabetes or anything like that?
You know, Doc?
Do you have diabetes, Joe?
No. I'm in perfect health otherwise.
Perfect health.
So you lost 6 teeth?
I'd like to get to talk to you, but I happen to be an executive of a hospital also.
Okay, so Joe, I'm gonna ask Dr. Sconzo because you're getting a lot of feedback, so I'm gonna put you on hold and you listen to the answer, please. All right, and have a great
Hello,
week.
it is. Wait a minute.
I'll see you very soon.
Joe, you have a couple of options there. You could look into dental implants. You could look into a fixed bridge. You can even look into some removables, depending on the condition of your remaining teeth. But you have a couple of options. You got to get back to a general dentist, not the oral surgeon, no. And you know, you can figure out what you can do to replace those missing 6 teeth. Good luck with that.
6 teeth all at once. I mean, you worried about some systemic disease?
Well, that's why I thought maybe diabetes or something like that. You know that.
And anything as an internist, when somebody comes in, he's losing teeth. What do you think of? Aside from poor gum, what about the greater picture?
Diabetes is the first one.
Diabetes.
Yeah.
Can you tell? Do you have ways to look in the mouth, Dr. Sconzo, and pick that
There's no
up?
definitive ways, but there are very different markers. Saliva is getting to be a big topic now, Steve. Next time I'll bring some information for you on that. Salivary markers for different diseases.
How often should Kirsten be going to the dentist? Young girl in good health,
At least every 6 months.
Every
At least
6
every
months.
6
Really?
months. Absolutely.
Very interesting.
Yes.
Cleaning? Is that with cleanings or?
Cleanings and checkup, exams.
So, and it's going to catch up with you. If you avoid going to the dentist now, it's going to get you later.
Absolutely.
Very good.
I need to get on that.
Get
And
on.
right now we have George patiently waiting. He's from Briarwood, Queens. He's on line 1.
Hey, George, how you doing?
Hi, doctor. How are you?
That Briarwood, whenever I come off to Van Wyck to go, I used to go to St. Joseph's Hospital. Is that Briarwood?
I believe so, yes.
Yeah. Are you living there a while?
Yes, yes. I lived here now for over 20 years.
What's your favorite part of Briarwood?
I like probably the Malloy area, the Boulevard and Queens Boulevard, going along towards the city.
Nice place. So what can we do for you tonight?
Well, I had a little bit of a problem with one of my 2 front teeth. One of them chipped yesterday when I was eating something, and I called my dentist, and he said that he wasn't able to see me this week, that I could see a substitute, or I could wait for him in a couple of weeks. And I was just wondering if that was okay, or would, God forbid, the tooth get infected, or...
Are you in any pain with it, first off?
No.
Okay, is it cutting your lip or your tongue?
No, it just looks a little unsightly, but it's a small piece.
Right, so you shouldn't have any problems. There's no reason why you probably can't wait, to see him later on. It's not going to get any more infected. As long as you're not, in severe pain or anything with it, you'll be fine.
Or it won't, break more, will it? Or that you can't really...
I couldn't tell you that. It depends on the condition of the tooth. But
could he have loosened up the tooth when he knocked it out and have nerve damage?
It depends on how severe the chip is. Okay, the nerve is in the middle of the tooth. Sounds like he said he just chipped off a little piece of it. So
the chip is where the 2 teeth meet.
Right, just the edge of the tooth?
It's the inner part of the front right tooth, yes.
Right. You could have even popped out a filling that might have been there,
Well, anyway, what we'll do is, can you give us a call back next week and let us know?
Okay, yes. Either way, I'll call you back, doctor.
All right, good to hear
Good
from
luck
you.
with that.
All right,
Take
thank
care.
you. Have a good night.
Okay, I'm going to start pushing next week's show because it's an amazing show. Musical guest stars are going to be performing here next week.
Wow.
So people don't want to miss this. I
Awesome.
see Kirsten's mouth is open wide. She can't believe it.
I love music.
We have an opera singer coming in, but it's not a boring opera. This guy's going to sing interesting opera with a religious theme. It's not easy to do.
Very nice.
So and people are going to enjoy that. He's going to do a 2-minute spot. We'll give you a warning when he's about to sing, so you have to leave if you don't like opera. But
there you go. But in the meantime, we have Martha on line 2 from Brooklyn.
Martha. Hi, Martha.
Hi.
How are you doing?
Good. How are you?
Good. How you don't sound too cheerful either. No, it's better. It's better. What can we do for you?
Listen, my boyfriend has no insurance, and he has a massive toothache in his molar. He can't eat. He can't do anything. Where can he go to get, you know, to get it pulled
It's a good
down
question.
or
Somebody
whatever,
doesn't have any.
kind of cheap, you know?
Dr. Scanzo has a sign on his door if you're out of insurance and he gives you the places to go. But let's see, where can he go?
Martha, the best place he can go to is probably a hospital setting. New York Methodist Hospital. He could either go to the emergency room or right to the dental department.
And they'll go ahead and they'll do something for him?
Excuse me?
Will they do something for him?
Sure, absolutely. They'll definitely do the best they can to get him out of pain.
You're talking to the boss over there, so he'll, if they give you a hard time, he has to
I
speak
see
to...
it every day. They'll help him out.
Yeah?
Absolutely.
So what do you think about now, ask the doctor? You like that?
What?
You like it? Now, ask the doctor came through for you.
Yeah, thank goodness.
Yeah.
I didn't know to go to a hospital.
Yeah. So now you know. Yes. Any other tips? Any other tips for people out there? The hospital's probably the best bet.
If you're in pain,
the hospital.
That's where you're going to go.
Yeah.
The emergency room.
Yes.
But don't call the ambulance. I've seen that. People calling the ambulance for a tooth.
I don't think I'll call an ambulance for a toothache.
I know she's the one that did it. All right, Martha.
All right.
Where are you called? Which neighborhood are you from?
What?
Which neighborhood in Brooklyn?
Gravesend.
Gravesend. They got hit pretty hard?
Not bad.
Not bad?
No, we were like right in the middle, you know. Thank goodness we kept our light and everything.
I'm glad. Had a good time.
Yeah,
and
you know.
Stop by when you're at the hospital. Say hello to me on the second floor, okay? Come up.
Second floor Methodist?
Yes.
All right, awesome.
Take care, Martha.
So long.
You too.
Be well. Who do we have next, Kirsten?
All right, Dr. Garner. On line 3, we have Stephen from Flatbush, Brooklyn.
Hey, Stephen. How you doing?
I'm doing good. How are you, doctor?
Is that with a V or a PH?
Oh, it's a V.
A V. How come people, they always ask that, right? I don't know how to make that confusing, that name.
Hey, you know, that's the way it goes.
Were there a lot of Stevens in your class when you were in elementary school?
There was a couple.
Yeah, I had like 5 Stevens in my class. You remember?
Right. Stephen G.
Yeah. You have a middle name?
It's William.
William, okay. I can't make much out of that, but that's good. What can we do for you tonight?
Well, doctor, I just have a quick question for you. I am an obese man. I'm over 400 pounds.
You're over 400 pounds?
Yes, I have an addiction to seafood. And I know that is very unhealthy, but I cannot turn down a meal with, say, lobster rolls or crab cakes or you name it. And I know I need to stop this, doctor. And so I need to know if you have any advice about how maybe I can cut back on this.
I have some good news. I have some good news for you. But first, I'm going to let Dr. Saponia tell you a little bit about your condition, and then I have something that's going to help end it. Dr. Saponia.
Great, thank you.
I think, Steve, you probably misled, because seafood is not that food only would cause your problem. Most likely, this is bread, carbohydrates, fat, and all high-calorie food. Seafood maybe they're high in cholesterol, but in terms of calories, they're not that great calories like carbohydrates or something. So the simple advice for you, if you want to be on a diet, have salads, vegetables, and your seafood, and nothing else.
Okay. I mean, at 400 pounds,
and if you can do it for a few weeks, you will see that you would lose weight.
Stephen?
Okay.
Stephen?
Yeah.
See, and I agree with Dr. Saponia. I want you to take that, but 400 pounds, it's a lot to, it didn't come on overnight.
Yes, I know this.
Now, next week, we have a doctor coming in who does lap band surgery.
Okay.
And I want you to call him Dr. Stevens, expert in that area. And he can come in, and it's amazing the results. Do you have diabetes?
I've gone to the doctor to find out.
Most likely, he's going to have some form of diabetes. Either he's got it or it's coming soon.
It's probably coming because of the weight.
So next week, I want you to call up, and he's going to discuss it with you. Maybe we can get you lined up to get this taken care of.
Okay, I'll try my best, doctor. Thank you so much. And can I just say to Kirsten, she is a beautiful lady.
Yes, very nice. So all of my. What about Dr. Saponia? I'm blessed. I'm blessed on Thanksgiving.
You're surrounded by gorgeous women, doctor.
And Dr. Scanzo is the only thing that brings me down to reality.
yeah, You got to deal
But
with
he's a
that.
great guy.
Yeah. Well, thank you so much. I really appreciate it.
Take care.
Thank you, Stephen.
You too. Thank
Bye.
you.
We get some satisfied customers here at Esther, right? It's a very happy week.
Yes.
I guess people are getting over that. Although the traffic still hasn't. Have you seen this traffic? I mean,
Yes.
this. I don't know if it's the Brooklyn Battery Tunnel or what, but do we have another?
You know, it's Grace.
Oh, Grace. I
Grace
would've-
on line 4.
The week is not complete without Grace. Hi, Grace.
Yes, hi, Doctor.
I was getting concerned when we didn't hear from you, Grace.
I almost forgot you were on because I'm a little in pain tonight.
You forgot we were on?
Yeah, I forgot. I'm in pain. I had my third Halligan injection. The first 2, I hardly felt anything, and I felt pretty good with my knee. I was getting along. I'll tell you, I got it at 12 o'clock, and some blood came out. I don't know if he had a blood vessel or whatever, but he applied some pressure on it, and it stopped bleeding, and I came home, and that was 12 o'clock I got the injection. But about 5 o'clock I started to feel pain in my knee.
Okay, Grace, let me just bring everybody up to speed here because she had these hyaluronic acid injections in the knee. And she had 3 of them now, Grace?
This is the 3rd on the right knee, but I took an Advil. I don't know if it was, I called the Halligan people. They said, you better get in touch with your doctor. But I took an Advil because I think one time he said, if you get pain, you
Grace,
can
one
take...
second. I want to ask, have you seen, I mean, it seems like it either works or it doesn't work. I don't get much of an in-between.
Yes, right. And you cannot expect pain relief right away after the injection.
You got to give a little time for
because
that pain
it's not
relief.
Pain relief injection. It's just substitute for the cartilage-like fluid that you're losing during the arthritis.
So Grace, you got to give it a little time again, but hopefully by next week we'll be improved.
It's nothing serious to get this pain, is it?
The pain hopefully will go away, but we don't know. We have to wait about how long, Dr. Saponia?
Yes, yeah, probably a couple of weeks.
Couple of weeks we'll know.
Because the Halligan people said if it lasts another day, you better get in touch with your doctor.
Well, when did you have the injection?
Today is 12 o'clock in the afternoon.
Okay, and it is,
take pain medications and go to see the doctor. If you
Dr. Saponia agrees. Pain medications and go see the doctor. Grace, you got to call us next week for our final show of the season.
Oh, all right. Was there a quiz?
You missed the quiz, yeah.
What was the quiz about? I want to know.
Well, it dates back to songs of the 60s, but I got to move on because I have one more caller.
All right, thank you.
Take care, Grace. Grace is an excellent quiz player, but she got a little confused tonight. But that is painful, that shot, so that could have done that. Kirsten, who is our final caller of the night?
Well, it's Joe.
Joe is that?
Yeah, so that's why I have an email, a really quick email.
Can I hear the email, then I'll say goodbye to Joe.
Sure. Florinda, she says, hi, my 85-year-old mom was diagnosed with a complex cyst for which she needs to get a CT scan. An ultrasound in August showed a cyst, and now in October, another ultrasound shows it had grown and changed to a complex cyst. She has type 2 diabetes, and recently a doctor told her to stop taking the metformin. That doesn't sound correct. Please elaborate if you can.
Right, and we're wondering the cyst, is it in the ovaries? Because you can get a cyst anywhere in the body. It's in the kidney. Maybe it's in the kidney. And the key is complex versus simple. Simple cyst, benign, don't have to worry about them. Complex cyst means it had bleeding into it. It's got a little septum inside of it. That you have to at least work up to make sure it's not a malignancy. Dr. Saponia.
Exactly the same thing. Especially if it's growing, you need to do biopsy.
Sonogram is a good way to evaluate it. There's no radiation involved with the sonogram, whereas CAT scans have a lot of radiation. So when possible, you want to reduce the radiation. I know in your office you've taken steps to reduce radiation.
Yeah, we have digital Panorex, digital sensors, digital, decrease.
So I'd like to just wrap it up. Quick bit of advice, Dr. Saponia, 10 seconds. How do they stay healthy?
How to stay healthy, Errol? Just have positive emotions.
That's a good one. Positive emotion, Dr. Scanzo.
Stay happy, brush your teeth, floss.
That's not
love
bad.
them, or they'll leave you.
Dr. Kirsten?
Ditto. Brush your teeth and floss.
And what about watch Ask the Doctor?
Oh, well, that's
I'm trying to leave this in. I'm throwing it the lines. I can't get it. So that's it, though. You had your chance. I want to thank Kirsten Elizabeth, Dr. Anna Saponia, and Dr. James Scanzo for coming in. And we hope we're able to help you. Now, remember, it's important. Always ask your doctor about other opinions. If you get an opinion, say, can I get a second opinion? If he says no, go to another doctor. Speak to your doctors about your concerns and visit our website at netny.net/askthedoctor. Here you can read the tablet column, you can watch past episodes, or you can email us questions to get them in early for the next show. I want to thank you for all your questions tonight, and don't forget, next week is our season finale, where we're going to be discussing lung disease, general surgery, and bariatric surgery. Also, let's keep in mind the families and friends and neighbors who are still suffering and were affected by the Superstorm Sandy in our prayers. I want to goodbye, stay healthy, and tonight at 9 o'clock, don't forget to watch the next show. Don't go anywhere after this show ends. See you in the tablet.